So hello, welcome to our channel, Ashdonic Training Solutions. My name is Michael Manguero and I'm one of the people that spearhead this channel. And I just thought I'd come back and apologize because when we made this channel, the intention was to post clinical videos, sharing clinical experiences, discussing OSCEs, and just to help overly people in the field of nursing in the UK. What has happened over the time is life has got in the way, so the videos just didn't come. And I can only apologize to all those who subscribe to the channel. The hope now is to do as many videos as possible, covering all the aspects of the OSCEs, and we're also going to be looking at some of the clinical situations that maybe some people are struggling with. So feel free to comment, subscribe, give us any feedback, and we can always try and make more content that is useful for everyone. So I just thought this is also a good opportunity to give you some background to who the people behind the channel are. For myself, my name is Michael. I'm a registered mental health nurse in the UK. I've been registered since 2016. And in my career, I've done many roles, most of which were inpatient services. But I've also done community services. I've also been in leadership positions over the time. So I just thought over time, people keep asking all these questions that maybe this channel was valid and it was something that would support people wishing to register on the NMC register. And it was also useful to discuss some of the challenges you might face post-registration on the NMC register as well. I'm also hoping that this channel will capture some of the things, the daily struggles that people might struggle with in the mental health field. I won't be able to give you much expertise in other fields, but I'm hoping over time we can get other experts in different fields, then they can come and also give their input for this channel. So my promise for the next couple of months, I'm hoping that at least each week we can post some of the outstanding stations for the OSCE. So we're going to be looking at all of the API stations. We're also going to look at all the professional standard stations. Then we're also going to look at all the other value-based stations as well. So I'm hoping to be posting a video on all of those stations. We've got some venues booked. We've got some of experienced practitioners booked. So all these people are going to be involved in filming all of those stations. Then we can give all of our practical knowledge around those stations, how to make it easy when you get to your OSCE, and also some of the challenges you might face preparing for that OSCE. In doing so, again, I can only emphasize comment, subscribe, then we can know exactly how to tailor the information to your standards and to what best works for everyone else as well. So at the moment, what are some of the topics that we're going to cover? We're going to be looking at the Mental Health Act. One of the many challenges that many people talk about is what happens post-registration. Some of that is the application of the legal framework. So Mental Health Act is probably the most used legal criteria for our detention of patients. We're also going to be looking at Mental Capacity Act, some of the challenges around assessing capacity. And we're also going to look at some of the challenges or the stigma around what happens as a new registrant in the UK. A bit more background to myself. I'm currently occupying a position of Director of Clinical Service in the private healthcare at the moment. Most of my career has been with the NHS. So we'll be able to cover some of the challenges within the NHS and the frameworks within that. But we'll also talk about some of the challenges in the private healthcare industry. This is not for international nurses. This channel is for nursing as an overall field. We'll be covering, like I said, mental health as the main branch of nursing. I'll also have someone that is going to be speaking on the social care side of things, a social worker. She's part of our team with the Ashdonic Training Solutions. We also have some people that are going to be talking about restrictive practice. But what I'll do is I'll get separate videos and people to introduce themselves. Then you can understand exactly where they're going to be touching on, where their expertise lie, and hopefully there'll be a lot of sharing across the different fields, and hopefully that will work for the channel. So please spread the word. We're going to be doing a lot more videos, and hopefully these videos will be useful for everyone. I'm looking forward to hearing from people and see how best we can make this channel useful for everyone. So hopefully you'll watch more videos, you'll keep tuned in, and hopefully see you all soon.